We spend our lives worrying about our parents' health. We worry about their sugar level, their heart condition, their joint, their hypertension issues. But one common thing we all overlook, their oral health, and we do not check until it becomes unavoidable. For many families, dental care for parents begins only when something breaks or completely fails. A loose tooth, an ill-fitting denture, pain while chewing, or a silence at the dining table. What's tragic? It's not the condition itself. How often the senior dental care is ignored, mistrusted, or rushed. Hello, I am Dr. Shuddhodhan Gaikwad. Today I am talking about the dentistry for our parents and what most clinics get wrong while treating them. As our parents grow older, they slowly start believing something dangerous. It's normal at my age. Tooth loss feels normal. Difficulty in chewing feels normal. Avoiding certain food feels normal. Speaking less feels normal. But nothing is normal in this case. What's happening here? It is the adaptation to discomfort, not aging. Study shows over 65% of people above the age of 60 live with untreated dental issues. And it's not like the solutions don't exist, but care feels unnecessary, inaccessible, and intimidating. And this is where the first mistake happens. Most clinics treat senior dentistry as an optional care, something secondary, something cosmetic, but actually it isn't. Dentistry for seniors is not the dentistry with wrinkles. It's something far more different. It's a different discipline. Parents don't come with just teeth problem. They come with weaker bone density, gum issues, dry mouth, multiple medications, past traumatic dental experiences, then fear of pain or discomfort, fear of being a burden. And the question is it really worth at my age? A young patient asks how fast this can be done. At the same time, a senior patient wonders, will it hurt? Will I be okay? Will I be able to eat again? When clinics apply same speed-driven, volume-driven model to senior care, something breaks. Trust. Modern dentistry prides itself on speed, same-day treatment, quick turnaround, and rapid consultations. But with parents, speed is not a strength, it's a threat. Senior patients need time. Time to process, time to repeat, time to understand, and time to feel safe. Rushing a senior patient through treatment planning, it's not an efficiency, it's a neglect. In senior care, listening is a valuable part of the treatment. I have seen many cases where the issues were not medical, they were completely emotional. One senior patient once said, "Doctor, you spoke more than you drilled. That's why I trusted you." That sentence carries more value than any technology. Many parents carry decades-old trauma from dentistry. Back when techniques of anesthesia was weak, drills were loud, and the pain was the part of the treatment. So when clinics say, "Don't worry, it won't hurt," without explanation, reassurance, or empathy, fear only deepens. Research shows more than 40% of elderly patients delay dental treatment not because of cost, just because of anxiety or fear of pain. And untreated dental issues won't remain in the mouth. They affect nutrition, digestion, speech, memory, facial structure, loss of confidence, and social withdrawal. Then this fear leads to delay, and delay leads to deterioration. Another mistake clinics make to advertise the technology as a marketing tool rather than a safety tool. For seniors, technology is not about looking premium. It's all about reducing risk. CBCT planning allows us to assess the bone quality before even touching it. Digital planning removes all the guesswork. Same day restoration reduce the visits, and conscious sedation will remove the fear for long procedures. Technology, when combined with empathy, becomes dignity. Dentistry for parents is never a solo decision. There is always a son, a daughter, or a caregiver involved. Most clinics only speak to the patients. Great clinics speak to the family. Parents need reassurance. Family needs clarity. When children understand the treatment plan, the risk, the benefits, then fear reduces for everyone. That's why transparency is critical. Senior dentistry is not about convincing, it's all about aligning trust across the generations. One of the most heartbreaking thing, parent says, what's the point now? And this core belief steals the quality of life. Age does not disqualify someone from eating well, speaking confidently, and smile freely. World leaders in the 70s and 80s still shaping the global decision and the world order. So why not our parents? Why should a parent believe they don't deserve comfort at home? Modern dentistry exists precisely to restore function, dignity, and independence, not just teeth. I have seen cases where clinical success came after emotional success. A patient who needed treatment years ago but waited due to fear. A parent avoided all likable food because denture didn't fit. A senior stopped socializing because he was feeling embarrassed. When we slowed down, outcomes improved. Not because the tools have changed, but yes, trust had arrived first. Patience. It doesn't delay dentistry. It enables it. Good dental care for parent is not fast, aggressive, or sales driven. It is gentle, predictable, transparent, respectful, and human. It treats parents like people, not procedures. If you are watching this as a son or a daughter, ask yourself, would you want your parent rushed? Would you want them confused? Would you want them scared in a chair? Or would you want them treated with patience, clarity, and care? Dentistry for parents needs more than skills. It needs responsibility. Because one day we won't be caregivers, we will be patients too. This is my philosophy of modern dentistry, where senior dentistry is not an afterthought. It's a commitment. Because every parent deserves care that feels like home. As I always say, dentistry is not expensive, neglect is.